You may start session now, Nitin.
Do we need to wait for some participants to join?
Nitin, will you introduce doctor?
Yeah. Give us, 2-3 minutes. We'll start.
Yeah, okay.
Yeah. Okay. Yeah.
It's already live. You may start within 2 or 3 minutes.
No problem. Yeah. Yeah. Yes.
Good afternoon, doctors. It's our absolute pleasure to welcome each of you to this insightful webinar. We are honored to have such a distinguished gathering of medical professionals here today. Before we start today's session, allow me to introduce our company, Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead to deliver superior and innovative care. Hetero Healthcare have established 300 products in portfolio and are pioneers in quality and innovation. We've also launched 4 biosimilar products within 5 years in the market and have a strong global presence in over 126 countries. So, welcome you all. The topic of today's webinar is enzymatic preparations with papain advantage in dentistry. So, to shed the light on the topic, we are privileged to have Dr. Satish Kumar Menon with us. Welcome you, sir. Dr. Satish Kumar Menon is MDS in periodontics with 10 plus years of experience. He is the founder of Kaizen Dental and practices exclusively in periodontology and implant dentistry in Navi Mumbai. He has also published various papers in the field of periodontistry. He also has a YouTube channel with 54,000 subscribers, and Instagram page of 19,000 followers. He has also written books, namely BDS Launchpad, Dental Launchpad. So let me welcome Dr. Menon for this session. This session will be of 45 minutes, and then we can have a question answer session for 15 minutes. Dr. Menon, you can please start the session. Welcome you, sir.
Thank you.
Yeah.
Let's see. Is the slideshow visible right now? I think you're on mute.
Yes, visible. We can see it. Yeah.
Yeah. So let's begin. Welcome all. It is usually a time between two sessions. In India, we practice dentistry in the morning and the evening. So taking out time, coming and joining us here to understand how you can improve the health of your patients and help them out it's a very good effort done by dentists to come in the afternoon and see the session. Okay. So I welcome you all. So before we begin, my first question to you is whether we are a young dentist or we are a senior dentist, what is the one thing that each one of us wants to have? I'm sure the answers might be absolutely varied. Some might say they want a satisfactory practice where they feel good when they treat their patients. Others would say that they want more patients so that they can do better service and better provide better treatments. On the other hand, some of us would jokingly say, of course, we want the money which comes along. But my question to you all is for all these three things to happen, what is the most essential thing you need to have? That is happy patients. If you do not have happy patients, you're not going to get more referrals from them, you're not going to get do more treatments on them, and all these things come down and boils down to getting more happier patients. Now let's for 1 second think that if we are a patient, what would we want from a dentist? And this might be for a varied set of patients. Someone who's a geriatric patient, extremely old, his teeth are shaking, completely mobile. He might be having various other illnesses and requires to get his teeth removed or teeth replaced. He wants a procedure which is easy, quick, and painless. On the other hand, you might have someone like a young lady or a man who's looking for maybe enhancing their aesthetic looks and taking care of their teeth when they have the entire set. Then you have small children who are not looking forward to the dentist visits but are being nagged and pushed in by their parents. Their main aim is to have less discomfort or pain free dentistry. So, our patients' perspectives, what we feel is they want discounts, what we feel is they are looking for good treatment, and on the other hand, we should try and understand what they want. When it comes to discount, I'll just tell you this case which I had seen recently. There was this group of dentists who joined together and put up a big practice in a city. This is the dentist, one of the partners of them, who had told me that he had a patient walking into his practice and he had advised him a given procedure and had quoted an X amount. The patient disagreed and said he was charging a lot. The same patient walked across the area, went to the other practice in which he is a co-owner. And since that practice looks better, the patient ended up getting treatment done there, paying 3x the times when it came to the amount. It means that patients are not always looking for discounts. That is not what they're always looking for. Yes, we need to provide them the best dentistry. But have you seen that patient who walks into your practice? When you've taken an X-ray, there's a short root canal, maybe 4 to 5 mm, and the patient says he's very happy with his previous dentist. You try doing a perfect root canal, the patient has slight pain or discomfort, and then he compares you with the previous dentist, where you have tried all your best to give in the perfect treatment, but the patient feels otherwise. So patients don't realize whether the charges are right or wrong. Patients don't realize whether the treatment is perfect or not. What patients want is proper function, aesthetics, and less pain or no discomfort when they are getting their treatment done. This is what the patients want. And to help us out with the less pain or no discomfort concept, we have various medicines which we use. Antibiotics and painkillers form the backbone of our dental practices. But we have very few things to take care of inflammation. When we consider inflammation, what we always prescribe are basic painkillers whose main job is to reduce pain, and like a side hustle, they are working on reducing inflammation as well. But before we try and understand the cause of this discomfort or inflammation, let us understand what are the signs. Inflammation is a reaction to any procedure. It might be trauma, it might be a treatment done by us. It is a body reaction in which you can see signs such as heat, that is calor, redness, that is rubor, swelling, that is tumor, pain, that is dolor, and later on loss of function. In dental practices, we mainly deal with the heat, redness, swelling, and pain, which are signs of inflammation post procedure which the patient feels. Now, is inflammation a good thing or a bad thing? Is the question. Do we actually have to reduce inflammation always? Absolutely not. Inflammation is a body mechanism where you might have some infection which is trying to intrude yourself, some trauma which has happened to you, and your body is protecting you from that trauma, injury, or infection out there. These are acute infections. But if these infections stay in your body for a long duration of time, they eventually become chronic infections or chronic inflammation, which can cause various diseases from neurological diseases to cardiovascular diseases to even cancer. So, our aim is to see that the initial phase of acute inflammation is not very discomforting to the patient. To understand that, we need to know how does this inflammation even act. So, whenever there is a trauma or an injury, okay, there are initial responses of certain cells which are there at the site. For example, you can imagine an accident site. When you crash your car, there would be 2-3 people who are standing around. They are your initial observers. Once they know that something has happened, they relay this information to other people. So some of them would call an ambulance, some of them would call the police, others will call their friends and family for sightseeing out there. This is exactly what happens in inflammation. So your initial cells send out certain mediators which are like cytokines and chemokines, and they invite the plasma cells and other surrounding tissues into that area to try and fight and protect that area from further damage. But it does not stop there. These mediators are of two types. One is which comes from the plasma, that is the blood vessels. Once the arteries open up, it gets on the blood vessels and they further call the rest of the gang to come and protect them. And some of them are the initial cell derived ones. So they have various pathways like the histamine, serotonin, which are basically your preformed mediators which are already present in granules of the cells. There are certain ones which are then generated like prostaglandins and leukotrienes. Other than the cell derived system, you have the plasma derived system which has complement activation and the factor 12 mechanism. So now these are the factors which cause various wanted and unwanted particles to move to the site of the trauma. So the whole point is, being a dentist, how does this even matter? मुझे कैसे? Do we need to solve it? Does it make any difference in our lives and our patients' lives? This is the question we as dentists ask whenever we have to add any treatment modality. So yes, it makes a difference. First, you need to remember, If any patient walks in with an initial injury or a trauma, he already is under a stage of inflammation. Forget that. Any treatment you do, whether it's a simple extraction or drilling for implants, even giving regular sutures in a particular area, causes trauma to that area and starts the inflammatory pathway. This can lead to discomfort, pain, and swelling. In today's day and age, if you ask your patients what is the main fear, one is maybe the anesthetic part, and second, after the procedure, even if they are comfortable during the procedure, they'll ask you, Doctor, घर जाने के बाद तो दर्द होगा कि नहीं? That fear is, if even after the treatment is pain and it goes pain free and absolutely smooth, will I have any discomfort or pain when I go back home? That fear is ever haunting your patient, and they are afraid that they cannot go to work, they cannot meet family and friends, they cannot eat what they want. It affects the general life of theirs. So it is our duty as dentists to go in and try and control these initial discomfort they have. Now, any sign of healing, imagine you've done an extraction. What happens first? It is clot formation. That is why we tell the patient, thukna nahi hai, or you're not supposed to spit. Second, you have the inflammatory reaction which we discussed about. Third, in the healing phase is your proliferative phase and your remodeling phase. So as dentists, we cannot do much when it comes to proliferation and the remodeling of the health of the tissues. Our main role is to see that the bleeding is under control and we are able to reduce the inflammatory reaction the patient has to our procedures. When it comes to this, one method is using medicines and prescriptions. So in today's day and age, you're supposed to use a combination approach which helps you improve the inflammatory and pain management, increases the speed of wound healing, and reduces the side effects compared to what the patient may usually have. So when it comes to all these things, just a plain antibiotic and a painkiller may not help. Adding certain ingredients which might help the wound heal faster is extremely advantageous for patient health and indirectly makes your patient happy and would like the treatment you have provided them. When it comes to these sets of medicines, a game changer introduced by Hetero Healthcare is Tolib. Now, Tolib has basically 4 components, that is trypsin, bromelain, roticide, and papain. We need to understand whether each of these medicines in a synergistic method affects your patient positively. It is only then you should prescribe these medicines. It's then we are true doctors who understand what we are prescribing and giving to our patients. So let's break down these into 4 parts. First, let's look at trypsin. Trypsin you have already learned in your pharmacology class. It's made by the pancreas. Once the pancreas make it, it is pushed into the duodenum where it is broken down into trypsin from the trypsinogen part which is created in the pancreas. So it is a component which the body already produces. So we are just adding on to it. Why do we do that? It is because it has certain effects on the inflammatory pathway. First is it inhibits the vascular permeability. Remember I told you in the start, it is those people who are in that area who see the accident happening or the trauma happening, the cells who call on the various plasma into the area by opening the vascular supply out there. So what trypsin does is it reduces vascular permeability. Other than that, it also reduces certain cytokines which might cause further inflammation and swelling out there. When the swelling reduces in a given site, automatically the pain response felt by the patient is also taken under control. The other important part it plays a role is in fibrinolysis. What is fibrinolysis? During your clot formation, you might have read that you see how the various cells form clusters out there and solidify that patch. This patch keeps on expanding. You do not want it to expand beyond a point because that would cause further swelling and pain. To reduce that, you have a process known as fibrinolysis, which is breaking down those clusters into easy structures where macrophages can eat them and clean up. So it's basically, if you do an extraction today and you're giving trypsin, the healing phase becomes faster and the swelling phase reduces. Now, before we give a drug, for example, trypsin, we should know, has this drug been used before? Does it really help the patient? So for that, we have to look at our MBBS colleagues. So trypsin is a drug which has already been prescribed in rheumatoid arthritis, various ulcers, even in eye, that's ocular disorders. This drug has been prescribed. So, a drug which has already been used in various other situations to help in wound healing faster is something which we can easily inculcate and use in our dental practices. So, after trypsin, the next drug part of it is bromelain. Now, bromelain is basically a digestive enzyme. If it is taken in a capsule form without any degradation, it is easily absorbed by the body. It is formed by pineapple. That's why they say eating pineapple helps you heal faster. Now, what is the advantage of bromelain? Bromelain is a multifactorial element. It helps you by reducing levels of prostaglandins, mainly PGE2. It also inhibits bradykinin. These are those mediators which we spoke about before, which increase the inflammatory pathway. It prevents platelet aggregation. Remember we spoke about trypsin. Once the platelet clusters are formed with fibrin, it eats them up. Bromelain, on the other hand, helps reduce the formation itself so that even before the swelling occurs, it tries and controls them. Other than it, it also acts on the cytokine pathways, that is the TNF alpha and the interleukin 1 beta. Again, when it comes to bromelain, whether this drug has been used before or not is something we need to consider. It has already been used for various roles like in chronic inflammation, malignant and autoimmune diseases. We have seen this drug being used to heal patients who are athletes. Basically, if they have a trauma or an injury, we have found out that giving bromelain helps reduce the time frame the athletes take to get back onto the pitch. So giving a drug which has been used frequently previously is something we should not worry while prescribing in our dental clinics. The third part of this combination drug is rutoside. Now, rutoside is something which is easily found in all plants. You find them in pea, you find them in apple, and they have been shown to have potent antioxidant property. In today's day and age, where everyone is looking at health, they know that having an oxidative cycle can cause damage to your body. And having antioxidants, why a lot of people have green tea, helps their health improve faster. In a localized manner, this rutoside is seen to have antibacterial, anti-ulcer reaction, which is something which would help us when it comes to our post-procedural inflammation. It prevents platelet aggregation, reduces vascular permeability, increases vascular flow. Why is this vascular flow part important is when there is a swelling out there and the macrophages are eating out into the debris, you want that portion to be cleaned out faster. So you want plasmatic flow and lymphatic drainage to be fast. So if after your third molar extraction or an implant procedure, the patient has a swelling, this helps reduce it faster by opening up the capillaries and strengthening them. It also acts as an antioxidant in the localized area. And similar to trypsin, it also helps suppress interleukin 1 beta and tumor necrosis factor alpha. Rutoside, similar to the other two drugs, has also been used by our medical colleagues when it comes to arthritis and other inflammatory diseases. So it's not a new drug. We are not experimenting with our patients. It is a drug which has been used, proven to be successfully used in patients who require faster healing. Then comes a game changer drug which is Papain. Papain, as the name suggests, is made of papaya. Basically, what they do is when you have raw papaya, which is green in color, it is hanging from the tree, it is not even cut off. There are four slits made. The liquid pulp which comes out is collected, and from that, a formulation of papain is made. We have seen that papain is very effective when it comes to various aspects, from strengthening your blood vessels, anti-inflammatory effect. It also has antioxidant properties similar to rutoside, and it improves microcirculation. The advantage of all these things it is doing at the blood vessel level is, as I told, it prevents the increase in swelling, number one. And if there is a swelling out there, number two, it helps eat out and declog the entire area. Imagine a piping in your area. If there's debris out there, you want that area being flowing so that you can clean up that area quickly and fast. That is what papain does. Again, an advantage. Papain has been used previously, even by athletes, in cases of leg ulcers, diabetic foot ulcers, in cases of burns. So it is something which has already been used. So if you are looking for a synergistic drug which helps combine the advantages of all of them, you have Tolib. Now what Tolib does is it reduces capillary permeability, reduces inflammatory response, it increases blood circulation, increases healing. It is said to have an analgesic effect similar to your regular NSAIDs, as well as it has an additional antioxidant property. So in basic, if there is pain, swelling and inflammation, Tolib plays a very advantageous role. So where do you prescribe it? You prescribe it in simple cases like post extraction. You simply prescribe it in slightly more complex cases like disimpactions. And wherever you're expecting inflammations, that could be a post implant surgery, or in major cases like jaw fractures, or if the patient has had a trauma, a punch, or post sports injury where you're splinting up the area, splinting up the teeth, you're giving an antibiotic and a painkiller just so that the healing is faster, prescribing Tolib would help. Now, why I would suggest out of the various drugs out there, thinking of Tolib. Tolib comes from a company, Etro Health, who have been manufacturing drugs for a long duration of time. It is not that they have come up with these components or these synergistic elements or these brands overnight. They spend time researching and seeing if it is actually effective and then coming up with the ideal combination. So prescribing a drug from a standard company gives you surety that is at least having some positive effect on your patient. Only then you should prescribe the drug. So in case you want to help your patient get out of inflammation quickly, prescribing Tolib would always help. Now, can a drug be given always and every time? No, every drug has some amount of side effects. And I hope you remember your pharmacological classes. Any problem, a side effect of any drug was always nausea, vomiting, and diarrhea. Similarly, with Tolib, you might have some patients who might have nausea, vomiting, and diarrhea. Other than this, it is a very safe drug to be given in 99% of the cases. What are the 1% cases we shouldn't be prescribing Tolib? First is pregnancy and lactating mothers. So if someone is pregnant or is a lactating mother, this drug should not be prescribed. Second, if the patient is having warfarin as a thinner, because it is already a blood thinning drug, and as we have already discussed before, it reduces clot formation, it reduces swelling Tolib. So if you're prescribing it along with warfarin, then there might be less clot formation. Second, if the patient is having a sedative like alprazolam or something, avoid giving Tolib. Other than that, it is an extremely safe drug based on the current research. You can prescribe it in all cases where you're expecting inflammation and you want your patient to heal faster. As we have already discussed before, To run a successful practice, you need happy patients. And what do happy patients want? Function, aesthetic, and less pain and discomfort. And giving drugs which help in that less pain or less discomfort always helps. That's where the patient says, मैंने अक्कल निकाला, ज़्यादा पेन नहीं हुआ. अक्कल निकाला, मुझे कुछ प्रॉब्लम नहीं हुआ. मैंने बड़ी सर्जरी की, फिर भी कोई तकलीफ नहीं हुई. So it's your skilled hand which will help you during the procedure, and it is drugs like Tolib which will help you after the procedure. So thank you, and if there are any questions, I would be happy to answer them.
If you have any queries, you can type in. Dr. Satish will be able to see those questions and he will answer accordingly.
As of now, there is no questions from audience.
Great. So
Nitin, do you have any questions? You may please ask to the sir so they can tell the answers to the audience.
So far, so good. I mean, Dr. Satish, thank you for such an insightful session. Very well presented. I mean, and very well explained. Thank you for all the knowledge. And yeah, any questions anyone has, or we wind it up then accordingly? Okay, I guess there's no question. Thank you, participant, for joining in. Thank you, Dr. Satish, for such a wonderful lecture and taking your time out. Privileged to have you. Thank you, everyone, for joining
thanks
in.
a lot.
Yeah, thank you from Metro Healthcare.